Bone Health, Medications and Supplements by Mark Lorenzato for VideoHealthGuide.com. A simple strategy. Follow the Paleo Legacy model of nutrition. Low sugar, low starch, low sodium, low refined oils, and supplement as needed. Diagnose and treat inflammatory processes. Know your medication side effects and review each one of its effect on bone. And schedule screenings of bone density. There are numerous medications contributing to osteoporosis. Of course, medications should only be taken when needed. Medications contributing to osteoporosis include corticosteroids, steroids that are used for skin rashes, for instance, for asthma, for steroid nasal sprays and such. Also, steroids are given for autoimmune disease, and sometimes they're essential for that. The PPIs, or proton pump inhibitors, used to treat acid reflux, hiatal hernia, and things like this. The PPIs are available both over-the-counter and by prescription. The SRIs are serotonin reuptake inhibitors used to treat depression and anxiety. Excess thyroxine or levothyroxine, the hormone used to treat low thyroid levels. If you're getting too much, it's probably accelerating bone breakdown. When an individual takes Coumadin, the anticoagulant known as a blood thinner, or similar compounds, similar molecules, one has to avoid vitamin K because it works through a vitamin K pathway. These are in leafy green vegetables. Vitamin K is critical for good bone strength, for bone growth and rejuvenation. Seizure medications, including phenobarbital and phenytoin or dilantin, will cause progression of osteoporosis, as will medroxyprogesterone used in birth control. Lithium, two medications used in diabetes, rosiglitazone and pioglitazone, both will contribute to osteoporosis. Cytotoxic chemotherapeutic drugs used in treating cancer significantly progress osteoporosis. Long-term heparin use will progress osteoporosis, and there are others. One can accelerate healing with targeted nutritional supplements, including vitamin D3, unless getting adequate exposure to ultraviolet B radiation, which in Northern California means you need to supplement between September and May, unless you're not getting ultraviolet B from sunscreen or not getting out in the sun in the summer, in which case you need to supplement year-round. The dosage is between 2,000 and 5,000 international units a day with food. Paleo Legacy suggests an anabolic diet for bone building, meaning enough protein to build up the collagen you need to build good bone. If vegetarian, one needs to be very cautious about lysine depletion because cereals are depleted in lysine and vegetarians frequently have excessive cereal in their diet. Also, they lack carnitine, creatine, and carnosine. I recommend all individuals, whether vegetarian or not, consider taking L-carnitine, L-carnosine, and creatine depending upon their meat intake. I take this along with choline, usually in the form of lecithin. Conjugated linoleic acids one should use with caution because the supplemental form is quite distinct than what we get in nature. But in some cases it may be very beneficial. DHA and EPA are the omega-3 fatty acids that are very critical for balance in our systems. They are available through range-fed animals, through game animals, through wild fish, or a supplement. Vitamin B12 is found only in the animal kingdom, including in eggs, and is essential for good bone growth, for delivery of adequate oxygen to the tissue for rejuvenation. DHEA, not DHA. DHEA is a steroid supplement that is over-the-counter because it is a natural product in our bodies. It can be taken particularly in postmenopausal women and in men of the same age to prevent osteoporosis and to accelerate bone healing. Vitamin K2 is recognized now to be preventive of the calcium paradox, where calcium accumulates in soft tissues such as cartilage and ligaments, the valves of the heart, blood vessels, as opposed to in the bone. Vitamin K2 was probably derived in animals from K1 they got in their green food that they ate. Now that we feed animals more corn and soy, they make less K2. We are probably K2 depleted for that reason. It is also available in some fermented products. And one should avoid excess of some vitamins, particularly vitamin A, biotin, riboflavin, for various reasons, but for vitamin A relative to bone growth. Supplements I recommend: the L-carnitine at 500 milligrams twice a day. Osteoblasts, the bones that stimulate bone growth, are stimulated through osteocalcin. Osteocalcin is dependent upon L-carnitine presence. L-carnitine deficiency diminishes osteocalcin. DHEA, as I mentioned, particularly in women of postmenopausal age and men same age. Calcium at 1,200 to 1,500 milligrams per day is an established augmented or supported need for those people that eat starch. And individuals that don't have a high cereal diet, they may need less, but it is a safe thing to consider. In general, the general population does better with a calcium supplement. Keep the calcium phosphate ratio in check. Too much phosphate from cereals can be damaging. An assortment of fat-soluble antioxidants in food include alpha-lipoic acid. Tocopherols from good vegetables and seeds and nuts is highly beneficial for good bone growth. And berberine, which is an anti-inflammatory used because it affects glucose regulation. It limits the progression of glycation, a damaging problem of adding glucose residues to proteins and other molecules. Berberine should be looked at in context of a need for other diseases such as diabetes, where it can be very beneficial, and insulin resistance and obesity. Other measures: consider monitoring your urinary pH if your bone healing is critical and you are not progressing away from osteoporosis, if you're not getting more dense bone. Consider vitamin E as a non-synthetic supplement. The synthetic supplement is not beneficial. I do recommend following screening guidelines for bone density, both central, the axial skeleton, and peripheral, your femurs, and perhaps the heel bones. Blood work to evaluate possible inflammatory causes, including a CBC, a complete blood count, a CMP, a comprehensive metabolic panel, a VAP lipid panel that shows subtleties and essential knowledge, essential information about your risk of maintaining a lipid flow without substantial antioxidants. Thyroid functions, testosterone when it's appropriate. Homocysteine is not of particular use, I don't think. Celiac disease should be screened for. This can be done with an anti-glutaminase. In the event that you have an IgA deficiency, this will not show up, so I recommend getting IgA total at the same time. And a food journal can be a very good means for monitoring progression. Diseases affecting bone healing include postmenopausal osteoporosis, where a woman could consider taking an estrogen replacement or DHEA, thyroid and parathyroid conditions, diabetes and prediabetes, fatty liver, metabolic syndrome, alcoholism, starchism, the consumption of excess sugar and starch, kidney disease, whether it's acute or chronic, and other diseases. Key points: diets high in oxidative stress contribute to both heart disease and osteoporosis. This can be from a diet high in fat and low in fat-soluble antioxidants and fat-soluble vitamins. Diets high in starch, sugar, and refined oils are osteoporosis causing. When oils are concentrated from plants by pressing or chemical extraction, we lose many of the antioxidants. It's better to eat the whole plant when possible. Look for underlying disease. If you recognize it, it needs to be treated for an effective strategy to manage the avoidance of osteoporosis. And follow screening recommendations by the DEXA scan, which has a minimal amount of X-ray radiation, of gamma radiation. A simple strategy: do the right thing nutritionally, supplement what you need, control underlying inflammatory disease, know your medications relative to bone loss. We're in the information era, something worth doing. And a different strategy to treat and prevent osteoporosis. In the case of treating it, we want to monitor very closely whether the therapy we're using is effective. Dietary measures. Paleo legacy, as I've said, is a good way to start. Calcium-rich foods include bok choy, broccoli, kale, sardines, soy milk, and others. Limit excessive protein intake. A very high protein intake that is just acidic, that is not balanced by vegetables, can be damaging. Caffeine up to 2 or 3 cups a day is not a problem. It's just well tolerated. And sources of calcium make a difference. Calcium that is in a more alkaline form, Vegetables is highly beneficial. Calcium with excess of oxalate or phytic acid, which are relatively anti-nutrients and can bind calcium and inhibit their absorption, are problematic. These are found in certain foods, which need to be looked at. Rhubarb, for instance, high in oxalate. Phytic acids high in spinach and beans. Mostly by cooking these things substantially, the phytic acid is denatured enough or is not a problem. As I said, lysine, the essential amino acid for absorption of calcium, can be deficient in cereal-rich diets. Frequently, vegetarians have lysine-poor diets. Thank you. This was Mark Lorenzatto for Video Health Guide.